Welcome, and thank you for joining Speak Up for SaferCare. Speak Up for SaferCare is a product of SaferCare Texas, the patient safety division at the University of North Texas Health Science Center in Fort Worth, Texas. Our mission is to challenge traditional thinking to eliminate preventable harm. Speak Up for SaferCare illuminates gaps in care, process, or design that leads to preventable harm in all healthcare settings. I'm your host, John Sims, Director of SaferCare Texas, and joining me is our co-host, Leanne Cunningham, Strategic Operations Assistant Director.
Good afternoon, John.
Today's episode 10, Executive Healthcare Leader Jumps Right In with Aaron Lopez. Aaron received a bachelor's degree in nursing in 2000 and quickly embraced healthcare marketing and leadership. He was the co-owner and founder of Urbane Scrubs, served as clinical liaison for Kindred Healthcare and Regency Hospital. He was promoted to Director of Business Development for Reliant Mid-Cities Acute Rehabilitation Hospital and to Regional Director of Stonegate Senior Living. Today, he serves as the Chief Executive Officer of Clearsky Health in Weatherford, Texas. Supposing that weren't enough, since 2005, he has served as Vice President of PMR Charity, Physical Medicine and Rehab, a volunteer position where local leaders deliver resources to North Texas residents suffering from healthcare-related financial hardships. Aaron, that is an impressive career summation, I guess. Is there anything that I left out that you want to add?
Yeah, I appreciate the intro, Rob and Leanne. Very, very, very kind of you guys. No, that gives it a sum up. One thing I think through all of that is we've always had a lot of fun doing what we do, and that continues to drive where we're headed next and to focus on what we're doing for the here and now. So thank you very much, John, for the intro. I appreciate it.
You bet, Aaron. And I got to tell you, every time I've ever seen you, you have a smile on your face. So that tells everybody that you're enjoying what you're doing.
It really does, John. I mean, in healthcare, where people are, they've likely hit rock bottom at a time in their life where a lot of things are unknown, from the marketing side of things and now to the executive side of things. People really need a friendly face during this time, especially during COVID when things are challenging. The anxiety's out there, the stress is out there. Last thing they want to see is a leader that looks stressed out as if they can't handle the problem. So, put on a happy face, take the next challenge, and we keep moving, John.
I love it, Aaron. So let's start out. So just tell us a little bit about Clearsky Health. What's their mission and how do they serve patients?
Sure. Clearsky Health started up about 3 years ago. They are in the business of acute rehabilitation. Inpatient rehab hospitals is what they're doing, and that is all they're doing. Weatherford, formerly known as Weatherford Rehabilitation Hospital, now Clearsky Rehabilitation Hospital, is the only acute rehab in Parker County. So there are only 5 hospitals owned by Clearsky. All are acute rehabs with plans to get around to 30 hospitals over the next 3 years. So we're going to have some rapid growth, and me and the owners are kind of in line. They, as a new company, a lot of their processes are, it's very difficult to start a very large company and blanket processes everywhere. So we've had the opportunity to contribute to the organization and develop as a new company some of the things that's now company-wide we started here in Weatherford. That was really the most attractive thing is during the interview process, they said, we don't believe that any idea is a dumb idea. We believe that what's best for your building, and if something makes sense, we're going to let you run with it. And so that's what got me here, John, was coming from large organizations to a organization that was taking off on the ground, and the ability for them to allow me to make, or the commitment to allow me to make my own decisions was very attractive. And that's really why I landed here, not to mention my area CEO is 4'7", and I'm only 5'6", so that was attractive as well. I'm actually taller than somebody, but it was basically the ability to be able to make an impact, and where change was needed, I could react quickly without having to go through multi layers, in a larger company to be able to impact a change.
Empowerment to make decisions. What a novel concept. I love
I
it.
like that. I
Yeah.
do. So, Erin, the pandemic has severely changed healthcare delivery. Can you share a few examples that you and your team have experienced?
Sure. There's been challenges all over the place with healthcare. Naturally, we've been challenged with the vaccination mandate that is actually on the 22nd, I believe, is the final deadline for hospitals and their staff and folks that take care of patients for their staff to have the vaccination. Um, Obviously, you have quarantine periods, you have visitation, you have, the unknown of a patient's COVID status. There's all sorts of things that we've had to obligate since, the corona has entered our world. And, and I think we've worked really hard to manage and deal with what we've had. And, I'm happy to speak about some of the intimacies, but, it can never be taken lightly in healthcare. We don't know what the next day is going to be look like really with staffing. So we take an aggressive approach to it. And, one of I think how we were so successful in getting through it was, we never never let our foot off the gas in regards to the EHS pay. It expired. We were participating, of course, to support our staff while they had to quarantine at home. We were paying our folks, to stay at home. That ended, and we chose as a company, and a big part of it was, I needed everyone to feel good about saying I'm not feeling good today. Is weird as that sound, and as weird as it sound, I wanted to be able to pay them, and so we made the decision to continue that when we didn't have to. So it's there's decisions now that are also being made, as we know. A lot of that program has expired, and we are continuing. It's no longer mandatory, and I anticipate us, at least committing to the next 3 months of doing that for staff. We'll probably phase it out at that point, but absolutely we'll pivot right back into it if I feel that we need to. It's just one of those things that makes sense.
Erin, I love the investment, if you will, that you have in your staff. And like you said, it's okay to be unwell, right? We're going to take care of you. I love that leadership mindset. You caught my eye. Your wife posted on Facebook of you during the our last COVID surge. You were in scrubs. And so I was, at that time, I know staffing was dangerously low in several hospitals. Explain how you and your leadership team responded to that staffing shortage.
Sure, and John, we had luckily, dodged a lot of bullets during COVID, and hadn't really had to maneuver too much. Now, naturally, stuff came up as it has for everybody. And ironically, during the last surge, we had reviewed an OSHA policy on contingency staffing, and actually threw out worst case scenarios to staff and how people would react. And so it really was just a matter of pressing the button when in 3 days we lost 12 folks. So we were in a situation where we had lost 90% of our providers that were taking care of patients or in the kitchen, that was going to affect us for the next 4 days. So, we looked at who was available, and quickly we maneuvered job titles, what was going to be safe. So we had therapists cooking in the kitchen. We had human resources is our unit secretary. We had our EOC or plan ops guy. He was our muscles as a CNA. we had an unbelievable response. Our transporter was answering phones at call lights. We had more staff over the next 4 days than what we could have possibly scheduled to scat. We just had people come out of the woodworks to help get us through the situation. So naturally, as the leaders were already prompted that, hey guys, if we're going to get in a tough situation, we're going to be the ones that are going to jump right in, and people will follow our lead. And it was a crazy drawing that looked like a spider web of arrows going every which direction, because people have babies, people have other obligations, and so it wasn't your typical 7 p.m. to 7 a.m. situation. It was a 4 a.m. To 12 a.m. Then you have a gap at 12:30. I can only be there for 4 hours on over. There was probably 50 different shifts that we had to cover. We're near capacity at that time, so we didn't slip, and I don't think the patients noticed. They got to meet a lot of people during those 4 days, but everybody put on the game face, and we owned it. So it was a neat situation to go through with a lot of people that cared. So
What a testament to serving others first.
Serving others first. I mean, and you're just that leadership. Y'all, it sounds like y'all took a proactive approach that, hey, we know this is coming. We're going to have a contingency plan. And guess what? We're not going to wear slacks and all that stuff to work today. We're going to come in scrubs, and we're going to, like you said, jump right in because we've got patients to care for. I think that is very enlightening for a staff to see their leaders want to rub elbows with them, and are happy to jump in and do the hard work that they do every day. That is just so amazing to me. I was going to ask you what inspired you to take this approach, but I think you've already kind of answered that, as you knew that this was a possibility, and you planned accordingly.
Yeah, we did, John, and we do all of the EOC drills that talk about worst case scenarios here in the building, from your hazardous vulnerability to your monthly safety meetings that we're doing, and we hold them religiously. And I really ask people to come to the table, and this isn't just something that we want to get checked off that we did for that Joint Commission survey. It's something that we really, take seriously. And we've seen Snowmageddon happen. We've seen, losing 90% of your staff. Stuff can happen, and we've done what we can, I think, to be prepared here at Clearsky and Weatherford. So it was a really I'm the laughing one of the facility. I always got a joke to throw out, but then I keep things seriously with a smile, I guess, is the best approach as to how I've tried to handle things as a CEO here. But it's been a lot of fun.
So I have a question.
Sure.
You say you're the jokester, so I'm assuming that's a part of your leadership style. Could you define for me a little bit more about your leadership style?
Sure. Yeah, absolutely. For example, I wouldn't say the jokester, but I tapped on it a little bit when we started, but I really truly believe if you can't come to work and have a good time and enjoy the people around you, if you can't come to be at work and be in an environment where you feel compelled to smile and uplift those that are having a bad day, I would question what I was doing, and am I in the right spot? So that's just the way that I've always done things in my career, and it's, I think, in the end you find out, who doesn't want to do that, right? You quickly find out who has a hard time having fun and enjoying things.
What type of things do you do, Aaron, to inspire those that work for you to come to work?
Sure, we do funny email stories. Like we start the day off in an operations call, and I will literally play music for the first 2 minutes of the call, and it's not your it's not your normal songs. Usually they're hip hop, get up, dance, and we have some people dancing in the room, playing the drums in the background, and some choose to sing. But it's just one of the ways that I've always enjoyed starting the day is do something fun, get up, smile, laugh, and that's just the way we do it. We have a weekly retention meeting that's usually lasts an hour and a half. A big part of the problem, prior to this hospital had been open for 6 months, but it seems like they would get good staff and lose the good staff. And so over the last year and a half, we've been able to, we do, you name it, we've probably done it. But we've done world's best hamburgers, world's best fajitas, Christmas parties, saran wrap balls, best decorating contests, best dress contests. It's Red Wednesday, Taco Tuesday. We've probably spent close to $75,000 in my year and a half just on keeping employees engaged and having fun. And I got a lot of questions asked, at first. And I said, we're engaging our employees. We have staffing shortages. People can go to California, especially these nurses, and they can make $100,000 in 3 months. So why would somebody choose to stay here in Weatherford is what we had to continually ask ourselves. So we have a very engaged management team. There's no idea is a silly idea. So we work very hard on bringing smiles and making people feel appreciated. And in turn, I think you get an engaged employee. You would be surprised how many people just weren't connected. You could send an email hospital-wide and nobody would respond when I first came. I'm like, hey, how do we do this? How do we engage these guys? Nobody's even connected to the system. And so one of the first things we did to engage people is we bought these fancy little shirts and spent $1,500 on some shirts and says, all you have to do is respond to an email. And then Aaron will personally come bring you a shirt. Just need your size.
Wonderful.
And so that was one of the first things we did. And now it's evolved to engaging employees and getting them to do surveys, or what do they consider the most important? What are the problems? We have to know the problems from the people, the ones that are doing it. And so anyway, it just now we're doing quarterly town halls, and we were, the first one we had 5 people, the next one we had 20. Now we have 60 people come to our town hall. We only have 130 employees. So it's been a really neat place to watch bringing some fun to the atmosphere and actively engaging people's opinions. It's really turned this whole hospital around.
It's amazing when you bring that sense of value into
It
play.
It does. And we quickly, we found out who was engaged, who wasn't engaged, and those that were engaged, they've stayed. And we've been able to, bring up our level of folks that are, in this for the right reasons. So it's really trickling to the patient, and that's ultimately why we're here. So,
Aaron, I have to say, I don't know if I ever saw you in a job and you weren't smiling, I don't think you'd stay there very long. I just don't. As long as I've known you, I've known you for 20 years because I met you in my last, with THR. And you were smiling back then. Didn't matter what was going on. It just seems like you respond to stress differently than most, I would say, and in a positive, and I mean that in a very positive way.
Yeah, maybe I internalize a little bit, but first of all, John, I think it's 22 years. It was 1999, and the healthcare system had just rolled out a little something called the DRG and a PPS system. I remember that time on Harris 6 very well. But yes, it's worked. It's worked for me my entire career. As a bedside nurse, briefly, I didn't provide direct patient care for long, but I quickly realized I needed more people to talk to. That trauma ICU, a lot of those patients weren't engaging back at me. But we found the happy spot, and we've figured out what a smile can do and how it can empower people to really give their best. It's been very, very productive in my career so far.
Well, positivity is contagious.
It is, and Aaron, one thing that you mentioned earlier is that we need to listen. If there's problems, we need to listen to the people that are actually doing the work. That is a high reliability organization principle, deference to expertise, right? So the people actually doing the work, we need to defer to those individuals so that we know where to target our efforts because they're the experts, right?
Oh yeah, I mean they're the ones that are getting dirty, John. And if we don't engage at that level and truly get them feeling comfortable to voice where the opportunities are, if they don't care about this job, are they really going to talk to you about it? So again, I think that environment that's created allows you to probe for more opportunities because they see somebody and they see your leadership team trying so hard to keep upping the game. You now have a lot of friends and a lot of people that want to see everybody succeed. And when we do succeed, we celebrate. We whatever that may be small, maybe big, but we let it be known. We try not to do, and this was an opportunity that one of the employees brought. They're like, "Hey guys, you guys are celebrating. Y'all are doing such a good job, but could you plan your celebration a little bit more?" And it's a fault as a guy, we have our faults, and I would walk in and I'm like, yeah, pizza for everybody. We did great. Did y'all see the survey results? And we'd spend $300 on pizza and bring in desserts and stuff, and that was for the day. So I learned something about celebrating. Plan it, and let everybody have a little bit more time to celebrate with you. And that was actually a strategy that we use is to start planning our celebrations of success a little bit more.
Well, that is an upper echelon leadership responsibility, planning celebrations. I love that. So, given everything that you've told us today, how would you advise other healthcare leaders to inspire their teams?
And I don't necessarily think, John, that there's one way that works, perfectly for every individual. But I've never seen somebody. I've never been on a team where I've seen somebody that's engaged and pleasant to be around. You get those two factors: people wanting to be around them, and they're engaged to get things better. That's definitely two aspects that I think that you have to have. You have to show people that you're in this with them. And step one, if people do not want to have you in their presence, if you don't have an aura of just a good word where people want to be around, we've probably you'll never probably struggle to get to that next level. So I would encourage leaders to take a look in the mirror and pause and highlight some of your positive aspects and try to grow them. Just try to work on yourself to spread a little good in the world. And usually people like that good vibe. I don't know what it is, but when there's good vibes going around and people want to be around it, your opportunities to attack are just so much better when people are engaged with you. So I guess that would be my advice. I don't think everybody needs to have fun or have that fun aspect that I like to bring. But I definitely think they need to figure out the good aspects about them and their leadership styles and try to expand on those to get people to want to buy into where they're trying to go.
I love what you're saying. It makes me happy to hear that. We work very hard for that type of mentality here in employee engagement within our system as well. I did want to ask you, what inspired you to pursue healthcare?
Well, I was going to be a doctor. I don't know why. Well, actually, I was going to be a fireman. Then I was going to be an attorney. Then I was going to be a doctor. Then I was going to be a CRNA. And I was like, well, we're just going to do the nurse thing, and then we'll go from there. So I met my wife and decided to get married, and that's where we settled. And so I knew I wanted to help people, didn't know what avenue I was going to go. So I somehow wound up in healthcare. I don't really know how I got here, but everybody just said that I was around like, hey, you can work anywhere you want to. You can be a free spirit. Healthcare is everywhere. And I've never left Fort Worth, Texas. But man, I could, I guess, if I wanted to, right? But nursing and healthcare has been a great career for me. And I never regret becoming a nurse at all. So it's been a great career.
But you've even surpassed that and gone into executive leadership. How did you pivot in that direction?
Sure. And I had been approached several times over the past 10 years to take that avenue. And I had young kids. Currently I have a 16-year-old, a 15-year-old, and a 9-year-old. So we've done all the coaching. We've played balls. I was there for my children, and the business aspect allowed me that flexibility. So I thought it was time, as my kids near college, to get into the operational side and see where that went. So the phone rang, and they caught me in a good spot and said, hey, it's like a great opportunity with a young company for somebody that's looking to grow. We've heard good things about you, and we heard you like to have fun. That's what the recruiter said. I'm like, okay, you got me. Who do I need to meet with? And so that's kind of where it started.
What a wonderful testimonial. You bring that joy and that value to those that work with you and for you. Exceptional. Thank you, Aaron, for sharing your knowledge and expertise today.
Absolutely.
And thank you to all who joined us for today's podcast. Speak Up for SaferCare is a product of SaferCare Texas, the Patient Safety Division at the Health Science Center in Fort Worth, Texas. We'd like to thank our technical producer, Rob Upchurch, for being with us today as well. We are calling you to action. Speak up for SaferCare. If you are a healthcare worker, counselor, subject matter expert, former patient or caregiver, and you have a patient safety story, we invite you to be our next guest. So please contact us through our website, safercaretexas.org. Also, follow us on Facebook, Twitter, Instagram, and LinkedIn at SaferCare Texas. We'll talk again next Wednesday. Thanks again for listening, and as always, speak up for SaferCare.